Welcome, everyone. Before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built in unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived in this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator. I will be hosting and moderating today's presentation, along with my colleague and co-host, Andrew Tomeyer, who is the Education Coordinator and who will be monitoring the Q&A box today. I am now pleased to introduce you to today's presenters, Joan Atlin, Deidre Lake, Ahmad Alkhatib, Sahar Zohni, and Mariah Maddock. Presenters, as I'm going to ask you now to turn on your video and as I introduce you. Joan Atlin is Director of Strategy, Policy, and Research at World Education Services in both staff and consulting roles. She has led and executed policy and program initiatives focused on professional licensure and workplace inclusion of internationally educated professionals. She served for 5 years as Director of Programs at the Toronto Region Immigrant Employment Council. Her experience includes developing profession-specific solutions in health and engineering. She has participated on national and provincial level task groups, including the National Task Force on IMG licensure and recently on the Bridging and Laddering Task Group of Ontario's Staffing Supply Accelerator Group for Long-Term Care. Joan co-chaired N4's COP working group to improve the pathways to optimal employment for ITPs. Welcome, Joan. Pardon me. Deidre Lake's career started with teaching. From there, she specialized in performance-based, competency-based assessment tools related to language, communication, and workplace integration. She's managed various programs and initiatives for nonprofit organizations and large institutions. She's been a member of various provincial and national advisory committees. From management, she moved into the areas of curriculum design and research. She's led several studies related to language assessment and longitudinal study on international medical graduates in Canada. Deidre has been working with international medical graduates since 2004 and brings with her a wealth of knowledge, experience, and ideas. She has proven track record in the development of innovative, high quality, outcome driven online and face-to-face training programs, including the highly successful MCAP program for IMGs in Alberta. She is enthusiastic and driven to continue, lead, develop, and implement quality educational programs. She is committed to excellence and passionate about IMG education, workplace training, e-learning initiatives, and the evolution of technology in the areas of education and healthcare. Deidre co-chaired N4's COP working group to improve the pathways to optimal employment for ITPs. Thank you for joining us today, Deidre. I'd like to now introduce Sahar Zohni, who is an internationally trained physician and project manager of the N4 National Newcomer Navigation Network. Sahar has a master's and doctor degree in pediatrics from Alexandria University in Egypt. She has 25 years of clinical experience as a clinician, lecturer, and researcher at the Alkhatib Pediatric University Hospital in Egypt. Sahar will be presenting on behalf of Dr. Ahmad Alkhatib. Dr. Ahmed unfortunately is unable to join us today because of a delayed travel from the United Arab Emirates, where he has been completing his currency of practice. Thank you for joining us, Sahar. And now Mariah Maddock is Partnership and Engagement Lead with N4 National Newcomer Navigation Network. Mariah coordinated N4's Community of Practice Working Group and co-authored N4's recommendation report that will be presented today. Thank you, Mariah, for joining us, and welcome to all our presenters. I just have a couple more housekeeping slides to run through and then we'll be on our way. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details on an alternate makeup time for the webinar. Before we begin today's event, I would like to take a moment to introduce you to the platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same questions or be interested in a particular response. Today, you have the option of upvoting a question. Please upvote questions you're interested in hearing the answer to, and we will prioritize which questions we pose to speakers first. With that said, let's jump into today's presentation, and I will pass the virtual podium over to our presenters to take it away. Thank you so much.
I believe my eye is frozen.
Okay, it looks like we're just having a small technical difficulty. Oh, no, we might be back. So we'll just bear with us for one moment while we get started out with our first presentation.
Great. Sahar or Colleen, I'll need one of you to share the slide deck for today. I'm just having a technical issue. But while that's being shared, thank you so much. Today's webinar marks the launch of N4's recommendation report, part of the solution, recommendations for welcoming ITPs into the Canadian healthcare system. And we will officially release this report with you towards the end of the webinar today. And our webinar today will explain how N4 convenes stakeholders from across sectors and geographies to develop concrete and actionable recommendations to support internationally trained physicians into the Canadian healthcare system. And some of you may be familiar with N4, but for those who are not, N4 stands for National Newcomer Navigation Network. N4 is a national network for the diversity of providers who assist newcomers in navigating the complex Canadian healthcare and social service systems. And N4's vision is for all Canadian newcomers to have a consistent and equitable experience in navigating health and social service during their settlement. So regardless of where they're settling, that experience is equitable. And so how does N4 do this? N4 has created a national platform for newcomer serving professionals to connect, learn, and collaborate around system navigation. And in April of 2022, N4's mandate was expanded to look at ways that we can improve the pathways to optimal employment for internationally educated health professionals. Thank you so much, Colleen. I'll just go to the next slide. And the next slide. Thank you. So the N4 network, who is in it, is made up of professionals in the health sector. This includes physicians, nurses, social workers, physiotherapists, occupational therapists, and internationally educated health professional. There are umbrella organizations such as settlement organizations and the regional and provincial level, and national professional associations for health professionals such as Canadian Medical Association, Canadian Nurses Association. Social services are part of the N4 network, and that includes settlement organizations from across Canada. And there's also those including academia. N4 plays a key role with supporting subject matter experts to put their knowledge and research into practice. The N4 network spans coast to coast and sector to sector, as you can see on this map. And there are currently over 1,300 professionals across Canada who are members of the N4 network. And on the next slide, you can see the N4 has 3 streamlines: connect, learn, and collaborate. And there are a variety of tools and features that can be accessed through these streamlines. And if you're not already a member, membership to N4 is free. There's no cost to join. And we'll put a link in the chat if you are not currently a member. Today, I'll be speaking to one of the tools in the Collaborate streamline, which is N4's Community of Practice. The N4 Community of Practice, also known as the COP, is a tool that N4 uses to convene stakeholders from coast to coast and sector to sector. They come together to work on short-term projects that have very clearly defined deliverables. And so now I'll speak to N4's work as it relates to improving the pathways to licensure for internationally trained physicians. We know there's mounting pressure on the Canadian healthcare system to fill labor market gaps. The COVID-19 pandemic exacerbated existing challenges in the health sector and caused a shortage of healthcare workers in all roles. It's estimated that approximately half of Canadians are either unable to find a family doctor or obtain a timely appointment with their current family doctor. The aging population in Canada adds to this crisis as the need for physicians increases to meet growing healthcare demands. And despite being highly skilled and valued as immigrants, Canada's newcomers experience significant challenges gaining employment even when their international field of study is in demand. And among Canada's foreign-born and foreign-trained physicians, a staggering 62% are not working in their trained profession. Improving the pathways to licensure for internationally trained physicians has been identified as a key strategy to address Canada's physician shortage and fill labor market gaps. So N4's Community of Practice was a tool that we used to convene stakeholders coast to coast, sector to sector, to come together to develop concrete and actionable recommendations to improve the pathways to optimal employment for internationally trained physicians. We also simultaneously formed a working group to do the same for looking at how to improve the pathways to optimal employment for internationally educated nurses. This work was guided by a steering committee. And initially, upon expansion of N4's mandate in April 2022, we began doing robust outreach and engagement across Canada to understand from those who are stakeholders along the pathways to optimal employment what they saw as some barriers and key facilitators to improving the current pathway. So we met with over 100 different organizations that included those in government, those who provide navigational support, regulatory authorities. We met with those in academia, doing work in research and policy, as well as several faculties of medicine and nursing. We also met with national professional associations, those in the health sector, certainly at the health human resources crisis top of mind, and had recognized that internationally educated health professionals can play a role in addressing the health human resource crisis. And most importantly, we also met from ITPs and IENs themselves to hear from them what their experience was like trying to obtain or obtaining licensure. So through this outreach and engagement, we were able to recruit members to our working groups. We had various organizations represented, which I'll share shortly. And we also wanted to incorporate the voice of lived experience into this work. So in addition to having the voice of lived experience represented on our working groups, we formed consulting groups of lived experience. So we had several internationally trained physicians who were at varying points in their process trying to obtain licensure and practicing in Canada. And between our regularly scheduled monthly working group meetings, we would meet with our consulting group. They would validate some of what we were discussing, but also tell us what we were missing. And their voice was truly instrumental in the recommendations that we will be sharing with you today. And I'll just go to the next slide. Oh, thank you. So N4's and in N4's and ITP working group, there were over 18 organizations who participated with over 20 members. And I just want to recognize the contributions of the individuals who participated from these organizations. There was significant work that was accomplished in N4's working group. And I'll just go back one slide, please. Thanks, Colleen. There was significant work accomplished not only in our working group meetings, but also between our working group meetings. Where possible, we strive to have representation and take a national approach to this issue. So for example, it wasn't feasible for us to have every regulatory authority participate on the working group. So we sought representation from the Federation of Medical Regulatory Authorities of Canada, recognizing they're an umbrella organization for several of those regulatory authorities. As well, for the faculties of medicine across Canada, we sought representation from the Association of Faculties of Medicine of Canada. And I'm also joined here today with our co-chairs of the ITP working group, Joan Atlin, who co-chaired the working group from West, and Deidre Lake from Alberta International Medical Graduates Association. And our members of the ITP consulting group had very diverse experiences in terms of trying to obtain licensure or becoming licensed. So our ITP working group members, some did their country of training was the United Arab Emirates, Nigeria, Iran, Ukraine, Egypt, Sudan, India, or the Philippines. And the map on this slide shows, or the map on the previous slide shows the countries of training of the ITPs that participated on our consulting group. So our working group initially began meeting in August of 2022, but as I mentioned, the work truly began in April when we did our outreach and engagement to understand barriers and facilitating factors. Initially, we started with understanding the current state and validating what some of those barriers were. We then did some visioning towards an ideal state, and this took place over two facilitated sessions. And from this visioning, we were able to develop some possible recommendations to improve the pathways to licensure. With the recommendations that were developed, we then did a recommendation analysis, which focused on identifying which organizations needed to be a part of a recommendation to move it forward, if there were any promising practices, and what were some implementation considerations. We also engaged the voice of lived experience throughout this process. And in March of 2023, we began developing a final set of recommendations. And today we'll be sharing those recommendations with you. We also did recommendation ease of implementation and impact analysis on each recommendation as well to determine which recommendations might already be underway or which ones would require a greater effort but have a larger impact. And so altogether, our recommendations, we formed 24 different recommendations that can be grouped according to the 12 themes that you're seeing each slide. And within our recommendation report that will be shared towards the end of the webinar, each recommendation described in detail, target audiences for implementation are identified, as well as key interest groups. And where possible, we made linkages to promising practices across Canada. And I'm now going to pass it over to Sahar to share what the recommendations are in the report.
You're on mute, Sahar.
Thank you. Sorry for that. I'll start with the first recommendation, which was around having access to reliable information. So just like any other immigrants who come to Canada, the internationally trained physicians would be seeking accurate information regarding the steps to get licensed, including the processes that it takes, the cost, what available support, financial support, and other supports might be there for them to get through the exams, for example, and what time would it take them, and also what are the likelihood of their success if they're applying for a residency or a PRA program. The accuracy and the relevance of these resources where they were getting their information from varied greatly, and sometimes it was even contradicting. And the information about the immigration and the license process was really siloed and difficult to understand when not expressed in plain language and using definite terminology. Furthermore, we found that the pathway to becoming licensed as an ITP was very complicated and would vary from one province to the other. So you can imagine how information would also vary and really needs to be recent information for them to help them make the right decisions. Navigating through all these, sources of information was very complicated with this fragmentation of the websites and where details could be found. So our recommendation is to create a user-friendly, up-to-date central hub for information to support decision making, as to make it for them easy for them to, or feasible for them even to go through the steps and make the right decision.
So the next recommendation involves not only the information itself, but access to navigation supports. Many ITPs report being recruited from their countries of origin as highly desired immigrants to Canada with the belief that they will be provided with support on their pathway to licensure post-immigration. However, after successfully immigrating, they're most often left to navigate the complex pathways to licensure on their own, either unaware of the navigational supports that exist and how to access them. So the recommendations in the report speak to establishing government-funded one-to-one navigation to provide support through the immigration process, through the licensure process, and ultimately into employment. There are also recommendations around establishing referral pathways to the existing ITP navigation supports and any new supports that come online. There is another theme of recommendations around data and information. The lack of a pan-Canadian health human resource strategy, including the collection, access, sharing, and use of health human resource workforce data, was highlighted in the 2023 House of Commons report from the Standing Committee on Health addressing Canada's health workforce crisis. And this lack of data, both the collection of it and access to it, includes data on internationally trained physicians. We need better data to support a better understanding of the physician supply gaps across the country and the potential of internationally trained physicians currently in Canada to help to fill those gaps. So there are recommendations around establishing a pan-Canadian data strategy, including data on ITPs, to have a greater understanding of the labor market gaps across the country.
So with regards to language proficiency tests, being able to communicate effectively has been consistently acknowledged as an important contributor to patient safety. But ITPs have had to demonstrate their language proficiency to both immigrate to Canada and then to demonstrate language proficiency for professional purposes. So for example, for immigration purposes, IMGs may have to do the IELTS general version, and then for professional purposes, it's the academic version that would be accepted. So one of the recommendations is to have a common list of acceptable language proficiency tests. And we recognize that there has been some alignment, of that with the regulatory bodies across Canada, but better alignment with regards to both immigration and professional purposes would improve efficiency and reduce costs for ITPs. And then furthermore, the understanding that the companies who administer the language proficiency tests, suggest a validity period for a period of 2 years. However, we weren't able to find, research that supported, for those IMGs or ITPs who are residing in Canada, speaking the official language, working and living in that official language, that, redoing the language test would be needed. So we're looking for better transparency around the exemptions across the board for the regulatory bodies, and to make those clear and transparent on their websites, because the exemptions do vary from a regulatory body in terms of what's acceptable for one compared to another. So looking for greater transparency and alignment along those lines. And as well, looking at the 2-year requirement and having ITPs consistently redo the language proficiency test, and looking at ways that if they have been residing in Canada and speaking the official language, to get rid of the need to continuously do this. Thank you.
Another issue was really around the license recognition. And when we looked at this, we found that the Royal College and the College of Family Physicians of Canada, they determine which ITPs they have an equivalency of credential. So each has their own lists of the approved jurisdictions from which they will recognize an ITP's medical training as being equivalent to that in Canada. This process only looks at the ITP's jurisdiction of training and neglects or does not consider at all if that, if the ITP themselves have moved to this jurisdiction and they became licensed there and they have years of experience already practicing in this jurisdiction. So while the country in which the ITP has completed their medical training may not fall within the list of approved jurisdictions, they may have a license, right? And a significant experience from those same approved jurisdictions when they immigrate to Canada. So I'll just give you an example. So imagine a physician who received his medical training, for example, and graduated from a university in Poland. And they move to Australia, for example, and they get their license there, they get years of experience, and then they decide to immigrate to Canada. Coming to Canada, Canada does not recognize their license that they have attained from one of the countries, Australia, which is one of the countries, one of the jurisdictions which is recognized for their equivalency of license, because the physician had graduated from Polish medical school. So again, our recommendation here is really to reconsider and recognize the license from approved jurisdictions outside of Canada, and not to only stop at the medical training. Another issue with the license piece is really has aroused, during the HHR crisis that we have witnessed for the last 3 years, and it's ever challenging, is the quick variation and the to license requirements that many of the regulators have adapted now, and they have been posting those, changes in regulations. The ministries have been doing that together with the regulatory bodies, and in an attempt for them to remove all of, some of those barriers to their license of the ITPs. So in addition of creating a lot of confusion for the ITPs in navigating all these new issues with the license. The ITPs themselves have to make decisions, right, around which province now they would fit their own path better than the other. So they would really have to move from one province to another. So this interprovincial movement of or migration of ITPs is becoming more and more common with the pandemic and post-pandemic era that we are in. So one thing that the Medical Council of the CME, the Canadian Medical Association, has been advocating for is having a pan-Canadian license. We also have, I think we see a benefit there for ITPs if this recommendation comes through, for having a pan-Canadian license instead of the provincial one that currently exists. I'll go to the next one. So another issue that we saw at the and we are having a recommendation around is really supporting the currency of practice. So it's really very difficult for ITPs when they come to Canada to gain any clinical experience, as there are very limited opportunities to practice healthcare settings in Canada unless they are registered as a regulated health professional. So as a result, the ITPs, they have to return to their own countries of license to maintain their own license there, and also to attain or get this clinical experience or recency of practice or currency of practice to fulfill this Canadian license requirement. In doing that, they, of course, they have to incur a lot of expenses. They have to leave their families behind, and they have to go to their own countries, which might even be not feasible for them if they're coming from a war zone area, and which makes it impossible for them to travel. So, and we heard lots of discrepancy about the amount of time that they need to have to spend there in their own country. So an average of 3 months is what we heard to our most knowledge. So as Mariah shared in the beginning of the meeting, Dr. Ahmad Alkhatib, who has been our co-chair for the lived experience, for example, could not join us today because he is still back in the UAE completing his recency of practice. He had to leave his family, his child here in Canada, and go back to practice in the UAE, just to come back, and still he's not sure that he will be able to get into the, to the license path, but incurring a lot of expenses, of course, and lots of mental issues and stress in leaving his family here. So our recommendation is really for, there is a need for identification of paid opportunities within every province that would recognize, would be recognized by the regulators as an opportunity for clinical practice, and would be recognized towards the recency of practice also. And this would help our ITPs gain that clinical experience that the regulators are requiring. Another recommendation is around, reforming the currency of practice requirements based on research. So really, we heard a lot about, what's recency of practice, or what's currency? Is it practicing for 3 months, or lately? What's the period between when you last practiced and when you are applying for license? So all these issues have to really depend on research, solid research, and be come from the regulators.
So with regards to mid-career ITPs entering Canada, the residency pathway, if they don't meet the requirements to go into direct practice through one of the practice readiness assessment routes, for example, then residency is often the only entry point into becoming fully licensed. And this pathway can be, often redundant, costly, and time consuming for those who have years of experience. So one of the recommendations is to convene stakeholders to review avenues for assessment and licensing of mid-career ITPs living in Canada who come with years of experience in international health settings. And so I think often, Sahar had mentioned earlier that often it's just the education or the training that is compared and the experience isn't taken into consideration. And just to share a brief story, 2 weeks ago, I was speaking to a urologist who had been a member of AIMGA for some time. Prior to that, they had practiced in Saudi Arabia, which is a highly sophisticated healthcare system, came here to look for career opportunities and options to practice, wasn't able to find a place in Canada to do that. Again, he was a specialist and working as a urologist, and then is now working in Ireland and left Canada as a result. So we are losing out on highly specialized and highly skilled individuals. They are looking at other options sometimes and exiting Canada as a result of that. So I think that this is an important recommendation and will require stakeholders to convene to look at different options.
So both Deidre and Sahar have referred to mid-career professionals, and the practice ready assessment is a really important avenue for mid-career professionals. It's a route that allows those who meet a certain set of eligibility requirements, including having completed residency training and been licensed and practiced in another jurisdiction outside of Canada, to go through a 12-week assessment program to meet a set of standards that have been established by the Medical Council of Canada and regulatory authorities across the country. This program, Practice Ready Assessment, exists now in 7 provinces across the country. However, Ontario, New Brunswick, PEI, Nunavut, and the Territories currently do not have PRA programs. The government of Ontario recently announced its intention to establish a PRA program pilot by the end of this year, by the end of 2023. And other provinces really should be making efforts to establish PRA, and that way enabling pan-Canadian opportunities for ITPs to be assessed and to work in areas of highest need. There are not, however, sufficient programs to allow access for all ITPs who immigrate to Canada. The programs that exist now, even in the provinces where they do exist, are very small relative to both the supply of ITPs and the demand. In addition, while Alberta and Manitoba have implemented PRA programs for specialists, other provinces are encouraged to follow suit. The majority of PRA positions available or assessments available are for family medicine. So the recommendations around this are to establish PRA programs in all provinces, to explore strategies to increase the supply of assessors who can do practice ready assessment, who can be the supervisors and assessors for this assessment period, and to allocate sufficient resources to be able to create a bigger pool of assessors. They, especially at a time now where we're facing extreme physician shortages, we need to ensure that we are able to remunerate assessors and make it possible for physicians to do these assessments. And as well, we need to address the issue of expanding PRA programs to include specialties and subspecialties outside of and in addition to family medicine, and to create the necessary standards for these assessments in other specialties and subspecialties. A further issue in relation to practice ready assessment relates to orientation. There are many existing training modules to assist ITPs in understanding the current Canadian healthcare context and understanding all of the non-clinical elements of practicing in the Canadian healthcare system that they need as orientation. There are high quality training pieces that have been developed by a range of stakeholders across the country and that have received really positive reviews from ITPs in preparing them with the non-clinical skills that form part of the PRA assessment process. There are not, however, sufficient programs or sufficiently funded to allow access for all ITPs who immigrate to Canada and those who are looking to pursue licensure. So having a single course or curriculum on the Canadian context for healthcare and enough capacity to provide this orientation to ITPs who intend to pursue licensure is our recommendation, to provide access to an orientation to healthcare in Canada and the healthcare context at no cost for all PRA candidates at a minimum. And the final set of recommendations around practice-ready assessment relates to the eligibility criteria. There are a set of eligibility criteria in order to be able to participate in a practice-ready assessment. And one of those is the Medical Council of Canada Qualifying Exam 1. The MCC QE1 is an exam that assesses general medical knowledge and clinical decision-making ability of candidates at the level expected of a medical student at graduation. The PRA program, however, is intended for ITPs who've completed residency training and have practice experience as licensed physicians in a jurisdiction outside of Canada. And in many cases, as we've heard, they also have specialized clinical experience. So the use of the Medical Council of Canada qualifying exam as an eligibility screen for the PRA has received criticism from ITPs for its lack of alignment with their skill level and experience and a certain underlying assumption of incapacity among ITPs who have practice experience in other countries. And so there is a recommendation to consider the alignment of this exam to the purpose of the PRA program and to study the possibility of its removal as an eligibility requirement.
So next we looked at the return of service agreements and how ITPs, after they participate in the PRA program or the residency programs, they are obliged to serve a number of years, which really varies from one province to the other. On average, it's 1 to 5 years in the rural and the small communities as part of an obligatory return of service agreement. Indeed, the PRA program was initially convened as a part of, initiative to increase the supply of rural and remote community physicians in these areas. But while this is framed as and also while it's really framed as a guaranteed employment for the internationally trained physicians, obligatory return of service agreements, they really create an equity for the internationally trained physicians. For the Canadian medical graduates, for example, there is no return of service agreements or there's and no obligation for them, despite both groups being really physicians who are also Canadians, right? So this is kind of, an issue that would really fall under the social justice and really inequity when you're looking at physicians who are both Canadians, and why this return of service is really only for IMGs. So as a recommendation, we have come up with a recommendation to remove this mandatory return of service and really to look at, expanding all the voluntary programs and incentives to both the Canadian medical graduates together with the internationally trained physicians. Go to the next one. We next looked at the exams, right? That the qualifying exams that are provided by the Medical Council of Canada. So another issue is with the MCCQE1, which is the Part 1 exam, qualifying exam, and the minimal or the cut-off scores of this exam, which is really used to determine which ITPs will be selected to move forward in the residency or the PRA program. They're not readily available for the ITPs. So ITPs, therefore, they had no way to understand whether, based on their MCCQ1 score, they can pursue a residency or a PRA pathway to license, and is this feasible or not? It is also not clear to the applicant if how significant is the MCCQE1 result, and is it the only element that the committee takes on when they are making a decision for them to be given a spot in the residency program, or do other, like, you know, their experience, for example, their interview, how well they did in their interview, does that even count, or are there any other factors that are taken into consideration when these decisions are made? So our recommendation is to really increase the transparency of the cutoff scores for the MCCQE1 applied by the selection committee and also by the NAC PRA and residency programs. Go to the next one. So another issue that the ITPs face with the licensing exams or the qualifying exams is really the NAC OSCE exam, which is the National Assessment Collaborative Objective Structure Clinical Examination, which is administered by the MCC, as I mentioned, and it's really to assess the readiness for entry into the medical residency. So this test is offered twice a year, and it involves 10 mock clinical assessments over the course of a day. The feedback that the applicants get after they complete their exam is provided through a statement of results, which shows a pass-fail result and what score would have been required to pass. And they also get what they call the supplemental information report, which has the sub-scores for each station and a graphical display of which compares them to other candidates. What is lacking in the feedback that's provided for the ITPs and would really benefit them would be what the scoring elements are for and what they stand for. And what ITPs are also not told is the failing result. Is it due to their communication skills? Was it due to their style in dealing with the patient, for example, or was it due to a lack of understanding of the Canadian healthcare system? So all this, all these issues are not something that is in the feedback that they get. And by providing this feedback, this would have really increased transparency, of course, and would allow ITPs really to work towards improving these areas that, the examiner felt that this was the reason for them to fail. So our recommendation is to provide accurate feedback and to the unsuccessful ones who do not pass the NAC OSCE test, and which would give them an opportunity for improvement.
So with regards to bridging programs, ITPs whose credential assessment is deemed not to meet the criteria for a practice readiness assessment, for example, are only able to basically then compete for residency positions. So not only are residency seats limited for ITP applicants, but this is they're not able to sort of be assessed to find out, where their gaps may be. And so it's not taking into consideration their experience again, and that they may bring with them and the knowledge that they do have. So, really we're recommending a system in which they have put in place for internationally educated nurses, for example, where their competencies are assessed and where there are gaps, there are bridging programs where they're able to, get the clinical experience that they need. So at the current time, there isn't something available for ITPs, and this would be a cost-effective solution to getting doctors into practice where needed, given the current context. And so our recommendation really is to develop clinical bridging programs or opportunities that do address the gaps in training, such as missed rotations or years of residency, or would meet the need for currency of practice requirements, and to ensure that ITPs do have the competencies needed to practice in Canada and to become licensed.
So in relation to residency spots, which is a major issue as it's one of the principal pathways into the system for IMGs and for ITPs, there is a lack of consistency between universities on whether and how IMGs are included, particularly during the second iteration of the residency selection process. And IMGs in this case include both internationally trained physicians and Canadians who study abroad. So depending on the province, there may be designated spots for IMGs as well during the second iteration of the residency match. However, standardizing processes among universities would increase transparency and facilitate decision-making by ITPs. As well, in the 2023 match, and consistently over time, a significantly higher proportion of total IMG spots were in family medicine or internal medicine compared to those offered to Canadian medical graduates who have considerably more access to specialty residencies. So the recommendations in this area are to make all second iteration residency spots available to ITPs in the provinces where this is not already in effect, as well as to expand the number of specialty residency spots that are available to ITPs in addition to the family residency positions. Second set of recommendations in relation to residency addresses transparency, and this issue has been raised in other recommendations as well. Opportunities for feedback to residency candidates are rare in the matching process. And for ITP candidates who've not had the benefit of extensive Canadian interview preparation or experience, an unsuccessful interview with no feedback represents a missed opportunity for growth and learning. So here again, the recommendations are to increase transparency from postgraduate programs regarding the criteria that they're seeking in residency candidates, and to establish tools and practices to reduce bias in the interview process. There is a best practices report on applicant selection that was endorsed by the AFMC a number of years ago, and the implementation of that best practice report by faculties of medicine would be an important step to support these recommendations in terms of transparency.
So we've now gone through 24 recommendations, which can be found in greater detail in the recommendation report. Andrew will put the link in the chat. You can access this report now, and it includes all the recommendations with much greater detail. It also includes the members who participated on the working group, as well as some information about who participated on the consulting group. So what will we do now with the recommendations? We have developed a communications plan. Our first step will be getting the word out about the work that has been completed over the last year, as well as making members aware of the report. And so we encourage you today to share the report with those who might be interested. We're also developing a very comprehensive knowledge mobilization strategy. So we're taking a look at each recommendation. We're identifying who the target audience is and how best to communicate that recommendation with them. Throughout this next year, we'll be doing one-to-one stakeholder meetings and developing different products related to the recommendation report to help to communicate the recommendations and then see them implemented. We'll also be doing quarterly meetings with the members who participated in N4's working group to improve the pathways to licensure for internationally trained physicians. We know that with several of these recommendations, a multi-stakeholder approach is absolutely critical. And so we're looking forward to updating our working group members on progress as it relates to implementation, but also staying abreast of the changes across the country as it relates to the pathways to licensure and practice for ITPs. And I'll hand it back to Colleen for a brief question and answer period.
Excellent. Thank you so much, Mariah, and thank you so much to our presenters. We do have some questions coming in from our attendees, so we'll dive right into those. But I would just like to remind you that we will be wrapping up the webinar in the next few minutes, and any questions that we do not have an opportunity to get to will be addressed in meeting place on the N4 web page. So always look for those there. So we'll jump into our questions. And first up, in Alberta, we have ACSAP, which is already paid FT clinical work, but is still not recognized as current practice simply because it's supervised practice. How do you propose to engage CPSA in changing this condition? And I believe we will direct that maybe to Deidre. And for ACSAP, it's the Alberta Clinical and Surgical Assistance Program for our audience.
Yeah, so I think, following the lead that other provinces such as Manitoba are doing, where these clinical assistant positions, people who are in those roles are sometimes exempt from being able to attach from currency of practice. And so I think looking at the same thing for Alberta, I think that there's a variety of things, having an assessment in place where people can be assessed in those roles for, their set of competencies and, for the college, in the same way that we do for practice readiness assessment routes. There always are a number of people that go from the clinical assistant positions into residency programs. But I think that for those people who would otherwise be eligible for the practice readiness assessment, who obtain a job as a clinical or surgical assistant, then have to make the difficult decision of staying in that position or, pursuing a practice readiness assessment route or leaving that position to do currency of practice. So I think there is work in the way to sort of address some of those issues, and for that experience to be seen as, one of the clinical experiences or currency of practice requirements.
Thank you very much, Deidre. Would anyone else like to contribute, or we can move on to the next question? Perfect, thank you. This one is related to language proficiency. So the attendee asks, can English language proficiency test requirement be waived for IMGs from Nigeria, South Africa, Kenya, Zimbabwe, and other countries that speak English as a lingua franca?
This is one of the questions I've asked myself many times. And I think all of us have who are on this committee and have been part of this process. I think that, yes, one of the requirements was for the exemptions to be expanded. And this would certainly fall under that category.
Thank you very much. We have lots of fantastic comments saying impressive work and thank you for this presentation. This one appears to be a question. So the problem is with the regulatory authorities, the College of Physicians and Surgeons of the province. They are not flexible and the requirements are difficult to register to get a license. I guess they're just looking for some suggestions on that. So problems with regulatory authorities, if there's any suggestions, guidance from our presenters.
I mean, I think all I would say in response to that comment is that the set of recommendations that this report and other reports that have come out recently all speak to ways to create flexibility within the systems without compromising on safety and quality. And that's what really all of the recommendations in this report and all of this work speaks to, is the ways to create that kind of flexibility, but to create it safely and within, respecting the mandates of the regulatory authorities.
Thank you, Joan.
I'll just add to that already some of the regulatory bodies have started implementing some changes, so which is kind of a good sign that they're open, right, to change. So yeah, so I mean, like and in meeting with some of them, there were like, we're still working on others. We're still reviewing some of those, regulations and really looking at evaluating them and maybe implementing some changes there. So yeah.
Fantastic. And then we have, what does IELT result expire? Does language proficiency diminish with time?
Yeah, it certainly shouldn't diminish if you are in an English or French speaking area. And so again, that was one of the requirements that is made in the report, is for regulatory bodies to look at that expiry. And again, it is at the discretion of the organizations that are requiring that. So to not make ITPs, continuously redo the examinations and to continuously demonstrate their proficiency requirements, particularly when some of the English language proficiency exams that they're doing aren't necessarily in alignment with the English tasks that they would be doing in the workplace as a physician, for example. So it is time consuming and it is costly. So we see that in the report.
Thank you, Deidre. Anyone else wanting to contribute? Okay, perfect. Any recommendations on how IHPs can access interest-free loans for exams, applications for professional licensure?
There are a variety of options, and so it could certainly respond, maybe send that to you, Colleen, so we can get that back to that particular person who's asked that question.
Absolutely. And thank you, Deidre, for that reminder. We will be sharing, obviously, our presentation today and any resources that relate. I'm just taking a look at our time now. So we're now at 2:03. It looks like most of the questions that we have are thanks, and we will, as I mentioned, take those other additional questions offline in meeting place. Thank you so much to our presenters today for joining us and sending this fantastic information to our members. We have recorded the presentation, so it will be made available. And if there are any other questions, please do reach out. And we look forward to seeing you at future webinars. We will be doing our next on April 26th. So thank you so much to our presenters and those in attendance today, and have a lovely afternoon.